I'm Josh, and in this video I'll be discussing acute spinal cord injury and recent advances in therapies. Acute spinal cord injury is a condition that occurs from a trauma to the vertebral column, causing damage to the spinal cord encased inside the vertebrae. The primary injury occurs instantaneously, causing permanent damage to the function of the spinal cord and the corresponding nerves. The most common cause of these injuries is as a result of a fall or motor vehicle accident. The population it affects is predominantly young males between the ages of 16 to 30, often attributed to risk-taking behaviours. The annual incidence is estimated at 750,000 individuals worldwide. Spinal cord injuries have two distinct injury phases, identified as primary and secondary. The primary injury can be classed as either complete or incomplete. In cases of a complete spinal cord injury, the patient will have no function of the spinal cord below the injury site due to a full severing of the cord, resulting in no communication between the nerves below the injury site and the brain. This affects the motor, sensory, and autonomous functions of the central nervous system. Incomplete spinal injuries, however, occur when the injury involves only partial damage to the spinal cord, resulting in varying levels of function for the patient below the injury site, dependent on severity of injury and patient recovery. Incomplete injuries make up approximately 95% of all cases. Secondary injuries are also a major concern, and these occur in the minutes, days, and even years after the primary injury. Hence, urgent medical attention is required when treating patients in order to prevent or limit further damage to the spinal cord. This involves immobilization of the spine, maintaining vital signs, and also monitoring complications involving the excretory system and shock. Surgical intervention is required to remove vertebrae or foreign objects affecting the spinal cord and repair any spinal damage that has occurred in the incident. After the initial surgery, the medical team will focus on any further secondary complications such as inflammation, ischemia, muscle spasm, excitotoxicity, and apoptosis. So, how do the injuries affect the patients in the long term? Of course, it depends on the site of the injury and the severity. The spinal cord has four main regions in descending order: cervical, thoracic, lumbar, and sacral. In general, the higher up the injury occurs on the spine, the greater severity of paralysis or limited function the patient will have in their body. Injury to the cervical region therefore produces the greatest degree of paralysis and is referred to as tetraplegia, which is a lack of motor and sensory function of the limbs and torso and can result in complications to functions such as the excretory system, respiration, and reproductive organs. More than half of all spinal cord injuries occur at the cervical level. Paraplegia refers to paralysis of the lower region of the body as a result of damage to the thoracic portion of the spinal cord and can also affect the pelvic organs. Damage to the lumbar and sacral regions can also result in paraplegia, while also affecting the bladder, bowel, and reproductive organs. Overall, any spinal cord injury will cause a drastic change in the patient's quality of life, with issues such as employment, independence, mental health, changes to the home, and maintaining relationships. Therefore, rehabilitation can include a combination of medical professionals such as psychologists, occupational therapists, dietitians, and physiatrists. Historically, treatment of spinal cord injury has involved preventing further injury rather than attempting to repair the damaged neural pathways. This was due to lack of research, understanding, and the ethical considerations due to the unknown efficacy of treatments. The ultimate goal of new therapies is discovering a way to repair and regain full function. One of the trial technologies is the use of epidural stimulators. These conductive devices are surgically implanted into the epidural space in the thoracic or lumbar region of the spine and were originally created to manage chronic pain over 4 decades ago. The device is able to be controlled remotely via a handheld module and helps stimulate the damaged neural pathways using electrical conduction down the nerves. Studies over the last decade have reported some miraculous results via these devices, most notably in patients with complete spinal cord injuries. In numerous cases, patients have shown an ability to control movements below the injury site, where the nerves have no connection to the brain. It is believed this can be attributed to the combination of the stimulator and intensive locomotive and volitional movement training, which allows for the reactivation and possibly creation of new motor connections in the severed spinal cord. This therapy is also very useful in retaining muscle mass in the paralyzed regions of the body early in recovery. Another treatment that has been recently utilized is through stem cells injected into the injured region of the spinal cord. Stem cells have the ability to generate a daughter cell and an additional progenitor cell which can modulate into relatively homogeneous cell populations. In the case of neural stem cell transplant, the key function is the prevention of further demyelination at the injury site and some remyelination resulting in significant restored function. These injections used in studies are typically administered only a few days after the primary injury in order to elicit the greatest chance of significant results. Other theorized actions of stem cells in spinal cord injuries is the regeneration of neural cells in the severed spinal cord and connecting a sequence of grafted cells to regain spinal cord function. More testing is necessary before stem cell transplant is ready as a mainstream therapeutic option for patients. Finally, metformin, a drug used in treating diabetes mellitus, has been trialled in spinal cord injury patients in order to prevent apoptosis during the secondary phase. Apoptosis is programmed cell death in which is accelerated in the epicenter around the spinal cord injury. Metformin functionally counteracts this process by suppressing the signal transduction pathway of apoptosis after the injury. This elicits a neuroprotective effect, reducing cell death in the injury site and preventing further axonal damage. Studies have shown that inhibiting apoptosis is vital in functional and pathological recovery of spinal cord injury patients. In conclusion, with further trials of these therapies and the Australian government allocating more resources to this research, there appears to be a breakthrough on the horizon for acute spinal cord injury patients.